Value-based care provides a great framework for restructuring healthcare systems. Unlike the traditional fee-for-service model, the focus of value-based care is on managing cost while aiming to improve outcomes and patient satisfaction across the continuum of care. But how does value-based care fit into cardiopulmonary rehab? Well, the benefits of rehab are well known. Along with improvements in functional capacity, quality of life, and several risk factors, participation also decreases hospital readmissions, as well as morbidity and mortality rates. Despite the mountain of evidence to support its benefits, cardiopulmonary rehab remains highly underutilized with a referral rate of less than 30% for eligible patients. So let's talk about what you can do to address this. The first step is analysis of current processes. Does your facility have a policy for automatic referrals to cardiac rehab? Adding an automatic referral to the facility's EMR is a quick and easy way to ensure cardiac rehab is always considered prior to the patient's hospital discharge. In addition to automated referrals, incorporating a multidisciplinary team that can work together across the spectrum of care to educate patients on the importance of cardiac rehab can have a huge impact on a patient's willingness to accept a referral. Make sure to include a designated cardiac rehab liaison as part of that multidisciplinary team who can screen patients prior to discharge to determine if they're eligible for cardiac rehab. They can also get patients scheduled for their initial intake appointment. Next, let's talk wait times. How long do patients have to wait for the initial intake appointment? Research estimates that for every day that passes between hospital discharge and the patient's initial assessment, the likelihood of enrollment decreases by 1%. So, what steps can you take to improve that metric? Consider a group orientation for intake assessments. This will require analysis of data elements collected during that assessment to determine what's appropriate in a group setting versus what should be reviewed one-on-one with the patient during their next visit. Also, utilizing a case management approach to streamline assessments and spread the workload evenly among staff can be beneficial. Once a patient is enrolled, how do you ensure they adhere to the program? On average, only 8% of patients complete a full dose of cardiac rehab. With statistics like that, increasing adherence can seem insurmountable. First, begin with your staff. Cross-training staff on all facets of rehab can help decrease delays and improve the patient experience. Evaluate current workflows to identify outdated processes and determine opportunities to improve efficiency. Be sure to include an analysis of the technology used for patient care and documentation. Is it antiquated? Does staff have to access multiple platforms for a single patient assessment? You should also consider alternative delivery models to progress patients through rehab faster. Concepts like LSI's 18-visit model ensure patients receive a full dose of rehab in half the number of visits. And finally, but definitely the most important component of all, get your team involved. If they feel like part of the process, staff will certainly be more open to change. Outcomes tracking has a myriad of benefits for everyone involved. For patients, it provides a snapshot of their progress in rehab from intake to discharge. While not all patients will see improvements across all components of care, highlighting areas where they did make progress is impactful. This information also provides an opportunity to set goals for patients post-rehab so they don't regress. Providers will also appreciate this information, considering that the #1 predictor of participation in cardiac rehab is the strength of the physician's recommendation. How can we expect providers to refer patients if they don't believe in the care provided? Presenting pre-post outcomes data to providers will help bolster the importance of your program and open the door for cross-team collaboration. And last but not least, administration has a vested interest in these numbers. Unfortunately, cardiopulmonary rehab programs are not a huge source of income for hospitals. However, each patient referral offers an opportunity to save money by reducing readmission rates, decreasing the likelihood of future cardiac events, and lowering morbidity and mortality rates.